The Introcan Safety IV Catheter, innovative, easy to use, and featuring a truly passive safety mechanism that protects both clinicians and patients. In a moment, we're going to see the entire procedure for properly inserting the Introcan Safety IV Catheter. By closely observing how the Introcan Safety IV Catheter is used, you will better understand its features, advantages, and what it means to patients and clinicians. Ms. Thompson is being prepared for a minor operation. The nurse will start an IV with normal saline. This will maintain an open line and allow for administration of fluids and IV medications during surgery. Before initiating the procedure, the nurse confirms Ms. Thompson's identification by asking the patient to state her name and by checking her wristband. Then the nurse calmly and reassuringly tells the patient why IV access is necessary and explains the procedure. The nurse has decided to establish peripheral IV access via the patient's metacarpal vein by inserting a 22-gauge Introcan Safety IV catheter. The first step is to gather and prepare all necessary equipment. In addition to the Introcan Safety IV catheter, she will need gloves, antiseptic solution, tourniquet, mechanical securement device, transparent dressing, and an identification label. All these items may be included in a sterile IV start kit. She will also need a sharps container. After checking the IV bag and primed IV tubing, the nurse is ready to begin. Before we watch the procedure, let's take a moment to review some key features of the Introcan Safety IV catheter. Introcan Safety needles are very sharp to allow for a greater flexibility of insertion angle and to promote smooth insertion. Introcan Safety has a transparent catheter hub that is color-coded to indicate the catheter's gauge. The Introcan Safety push-off plate allows for one-handed insertion of the catheter and also serves as a bevel orientation indicator, ensuring proper alignment of the bevel throughout the insertion. The Introcan Safety flashback chamber, which catches blood return to indicate venous access, is a cylinder designed with ribs to give the clinician a secure grip during catheter insertion. Introcan Safety also features a removable vented flash plug. The flash plug can be loosened to increase the speed of blood return or can be replaced with another device, such as a syringe or a blood collection access device. One of the most significant features of Introcan Safety is its passive safety clip. Prior to catheter insertion, the passive safety clip is housed within the transparent catheter hub. As we'll see in a moment, the clip is automatically engaged during needle removal to permanently cover the needle tip. This technology simplifies safety procedures and assures safety compliance. Now that we know a little more about the Introcan Safety IV catheter's features, let's see how proper insertion is accomplished. After washing her hands, the nurse is ready. She ties a tourniquet around the patient's arm about 6 inches above the insertion site and asks the patient to make a fist and squeeze tightly 4 to 6 times. With the tourniquet in place, she cleanses the skin with an antimicrobial solution around the insertion site and allows it to air dry. She places on gloves and then removes the protective cap from the 22-gauge Introcan Safety IV catheter. Without touching the cleansed area, she stabilizes the vein by stretching the skin and holding it taut. With the other hand, she grips the Introcan Safety IV catheter by its flashback chamber and holds it at an appropriate angle over the vein. Using a smooth, steady motion, the nurse inserts Introcan Safety through the skin and into the vein. The sharpness of the Introcan Safety needle allows for smooth venipuncture and minimizes patient pain. A consistent layer of lubrication along the catheter also helps facilitate a smooth, easy insertion. After observing blood return in the flashback chamber, the nurse lowers the device parallel to the skin and advances the needle and catheter together 1/8 of an inch into the vein. Then she uses the push-off plate to thread the catheter into the vein. The Introcan Safety push-off plate is located on the middle of the hub to minimize the risk of hub contamination by the nurse's finger. At this point, the nurse releases the tourniquet. Before removing the needle, the nurse uses the V technique to simultaneously occlude the vein and stabilize the catheter hub. This technique minimizes blood spillage from the vein and prevents dislodgement of the catheter during needle removal. The nurse withdraws the needle with a swift, continuous motion parallel to the skin. The needle glides through the clip smoothly. As the needle tip exits the hub, the passive safety clip is automatically engaged. This safety feature requires no user activation and cannot be bypassed. The clip permanently shields the needle tip, preventing reinsertion of the needle into the catheter and protecting the clinician from an accidental needle stick injury. The nurse connects the extension set to the catheter hub. She covers the puncture site with a sterile, transparent dressing. She then stabilizes the catheter using a mechanical securement device. The nurse connects the primary IV set to the extension set. And writes the date, time, size of catheter, and her initials on an identification label. Ms. Thompson's Introcan Safety IV catheter is now in place. All sharps should be properly disposed of in a sharps container. Now that you have observed the proper insertion of the Introcan Safety IV catheter and reviewed some of its key features, you can better understand the many benefits Introcan Safety IV catheters provide to both clinicians and patients.